The Body Shop with Meredith McDonough and Dr. Steve is brought to you by Allegheny Chesapeake Physical Therapy.
Good evening and welcome to this week's edition of The Body Shop with Dr. Steve. I'm Meredith McDonough. Tonight we're talking about osteoporosis, which affects about 10 million Americans. Talk about a major problem, Dr. Steve. What do we do about this?
Well, the best thing we can do about it actually is to try and understand it. And understanding it means that we need to understand what bone is and what osteoporosis means. Osteoporosis is a normal bone, but it's less dense than what we normally have. In other words, when we're a child and we're growing up, we accumulate bone, we put more bone on, it's strong, it's solid. As we age, and with the disease of osteoporosis, you lose some of that strength and density. That strength and density is really what happens in osteoporosis. It becomes less dense, less strong, and more prone to fractures.
All right. Now, does osteoporosis affect only men, women? What's the statistics there?
Most people think it just affects women. And the reason they think that is because women are affected by osteoporosis earlier in life than men. Somewhere around the 30th decade, 30 years old and later, we all start to lose bone. Women tend to accelerate that loss during menopause. So they are affected earlier in life. So there's more women at one time affected, but actually at about the 70th decade, men catch up to women, and it affects them equally.
All right. Okay. Well, Dr. Steve, then what can be done to treat osteoporosis fractures?
Well, there's a whole cadre of things you can do for treatment. The one thing that there's really strong evidence for is exercise. Exercise, if it's started, can decrease that sort of less dense, that sort of pulling away of the bone and making it weaker. You can slow down the progress. There's no cure at this point for osteoporosis, but if you can slow down the progression, you can last longer and not be as vulnerable to fractures.
Well, that sounds like good news to me. I mean, obviously not good news that there's no cure, but in the fact that, there's something you can do about it.
Absolutely. It's great news. It's great enough news that if you institute the exercise, you can really slow down the process, potentially avoid the fractures. The bad news is, if you just go out and exercise and work out at the gym, there are wrong exercises that can actually make you more vulnerable to a fracture, and you don't want to do that.
All right, let's talk about those wrong exercises. Can you give us an example? None of us want to do that.
Right. The best example probably is that one of the most vulnerable parts in your body with osteoporosis is your spine. And we all seem to want to work on our midsection, and sit-ups are probably the worst thing you can do if you have osteoporosis. And I know that's everybody wants to do sit-ups because they want to be leaner, but if you have osteoporosis, doing a sit-up actually puts pressure on the spine and the section of the spine that is the most vulnerable to fracture. So that's an exercise you don't want to do.
I'm in trouble. So if we're doing sit-ups, what should we do then if we can't do that?
Well, let me clarify. Okay. Sit-ups are not good for folks that have a diagnosis of osteoporosis. If you're like yourself, you want to prolong that process before you hit osteoporosis, sit-ups are okay. But once you've actually been diagnosed with osteoporosis, that density is fragile now. That's where you don't do sit-ups. Really, the best thing to do if you have osteoporosis is to go to see a physical therapist, get a specific program that's osteoporosis specific. It gives you good strength, helps to keep that bone strong without making it vulnerable at risk of fracture. And that's a little bit unique for everyone. So it's better to get a customized program.
All right, that works best for you and your body.
Absolutely.
All that good stuff. All right, Dr. Steve, any last advice for us that we need to know at home?
Well, if you're not sure whether you're vulnerable for osteoporosis, you can check the website, Allegheny Chesapeake, also for the Osteoporosis Society. You can go there and check and see. Women are obviously more vulnerable than men early in age. Young, white, thin Asian women, okay, those are one. Postmenopausal women, post-hysterectomy. If you drink alcohol or caffeine, you're also more vulnerable. Those are the kind of risk factors that you need to know. And if you fall into any of those risk factors, you really want to start some kind of a program to stop that progression so that you're not at risk later in life.
Well, thank you very much, Dr. Steve. Always a pleasure. And if anybody has any questions, give Dr. Steve a call at 1-800-NEW-SELF. And also you can log on to www.AlleghenyChesapeake.com.